Hi everyone. Today we are going to be talking about the main points that we've covered in this course so far, and I won't be going through every single lecture that we've done over the 13 weeks, but I'm going to give you just a snapshot of some of the most important points that I want you to take away when you finish this course. So the first one is about what makes a difference. Now, we talked about this in our first lecture. Surprisingly, the approach or method that we use to work with the client has little impact on change for the client or the outcomes for clients. The client themselves accounts for about 30% of the outcome. So in terms of how severe the problem was to start with, how ready they are to work on things, how many resources they have in their lives, like supportive family and friends, accommodation, employment, good health, all those kinds of things. What they believe about themselves and others, and what they believe about counselling and whether it can help. Their experiences of getting help before, and their attitudes to life and to mental health and to well-being and to improving their life. So all of those factors can impact the outcome for a client, as you're working with them. However, we can have some impact on these client factors when you're able to look at the client as an individual and see how they see their problem. So see how they understand their particular issue, and make sure that our interventions fit with the way they see the world and the way that and their values as well. So we need to take a person-centered approach by looking at the person and how they see the world, and then adapt or develop a treatment plan according to that. So that's how we make the most of those client factors. Therapeutic relationship. Well, we know that the therapeutic relationship has an impact on outcome, and it is essential for successful counselling. And that's regardless of what approach you use, whether it's CBT or psychodynamic or schema therapy, whatever you decide to use. Person-centered approaches focus on the development of that relationship. And that's why in this course, we take a person-centered approach first and foremost, because it focuses on developing that relationship and seeing the person for who they are and where they're at the particular time. And that can be a really good base for expanding your interventions or learning a new approach and adding that to your toolkit. But first and foremost, looking at the person from a person-centered perspective. It's important to find your style as well. And sometimes students, when they're starting out, they tend to maybe copy a therapist they've seen, or maybe a therapist they've been to before, or someone they've seen on TV. And it's important, and that's all fine, but it's important to find your own style as well and know that that's uniquely you, and it will come across more genuine if you are staying true to your style. Paraphrasing. So the reason we do paraphrasing is not just to give you a headache trying to think of how to best paraphrase something. It's so the clients can hear back what they're saying, because sometimes things can get muddled and they go round and round and round in their heads. So hearing back what they're saying can help clarify the problem or the way that they're thinking about something. It also communicates that you've heard and understood the issue or what the client said, so it can help develop that therapeutic alliance and relationship by communicating that you've heard and you get what they're saying. Empathy. So one of the very simple approaches that we used was using, so you feel sad because you haven't seen your mother for a couple of weeks. And that's a really simple approach. You can, once you feel more comfortable with using empathy and naming an emotion and expressing that, you can mix it up a little bit. You don't need to stick to that little structure. Make sure you're using the right family of emotion and the right intensity of emotion. So don't say, that, oh, you're furious when someone indicates that they may just be a little bit frustrated. That's really important for a client to feel understood when you get the right intensity of emotion. And really importantly, if you care about someone, if you have a feeling response to something that a client's saying, more often than not, it's a useful thing to tell the client. So if you care about them, if you feel, oh, you know, that sounds really difficult, oh, I feel really sad for you, or when you're saying that, I feel quite sad, or when you're saying that, I feel really excited to hear you talk about your new job. So let them know that you care. Let them know that that you feel for them. But being mindful of all the pitfalls of self-disclosure as well. So making sure that it's for the client rather than for you. Which just brings us to the next point, questions. So making sure that we're using lots of open questions really opens up the dialogue, allows the client to take charge of where it's going, and it allows a better flow of dialogue. You can use closed questions if you need to gather information, particularly in the first session where you need to know something particular, or you need to find out about the person's home life or demographics or other details. Try and use tentative questions. So keep those questions open and tentative. So stay open to being wrong. That's a really important skill as a counsellor, is that we stay open to being wrong. Avoid using leading questions, assumptive questions, where we make an assumption about someone and bury it into a question. Shotgun questions. I know some of you struggle with this, and that's because you're still learning how to use open questions, and that's fine. But if you find that you're using, say, 3 or 4 questions in a row, all bunched together, it's okay to say, stop, actually, scrap that. Can you tell me more about that? Yeah, when you notice you're doing shotgun questioning, just notice it and go back to an open question. And why questions, we want to avoid those because they suggest that the client needs to defend their actions. Now, always remembering that we don't want to be asking questions just for our own curiosity. So is this question for me or is it for them? Is it going to help them develop more insight? Is it going to help me assess where the client's at and where we might go with this? Or am I just interested? Do I really just want to know, more details about this? So developing that self-awareness, whether it's for you or for them, is really important. So assessment. So we want to be doing an assessment when we first meet with a client, because it allows us to develop a treatment plan. It allows us to make hunches as to what's leading to a problem and what's making it worse, what's keeping it going, and what strengths the client has that we can really help point out and build on. It can help you find patterns between situations or relationships or behaviours or themes in someone's life. And it really provides you with a roadmap and a rationale for where you're going to go in terms of treating the client. Goals. So remember that some clients don't really have an idea of what they want to get out of therapy or a specific goal. They just want to feel better. And our job is to help them nut out what that means. What would it look like if you're feeling better? What things would be different, that kind of thing. So our job is to help clarify with the client what those goals are. And that can take, 1, 2, 3 sessions to help explore a client's values, the things that they're not so happy with in their life, and that kind of thing. And that's the case for clients who are coming on their own free will, or mandated clients as well. Everybody has values, and everyone has things that that they're unhappy with in their lives and would like to change, just maybe don't know how to do it. Often when a client develops a better idea of what they want to get out of their life, or what they want to change, they're on a path of some kind of change already. So that is part of the change process, when we can help someone identify what they want to change. Also, people's readiness to change is not constant. So we need to, if someone's ready to make a change, we need to work with them in that moment to help them develop a plan of how they're going to do that. But that, it might go in a cycle in terms of readiness, and perhaps 6 months previously that person wasn't ready at all. So we need to understand that if a client's coming in and they're not quite ready to change something, it doesn't mean that they're never going to be ready. It just means that they're not ready right now. And we need to work with them on what they do want to, look at in their lives, rather than trying to force them to make the changes that we think that they should do. Finishing up. So make sure when you're working with someone and, you've got 6 sessions to work with someone, prepare them. So let them know we've got 3 more sessions left. We've got 2 more sessions left. Is there anything that you want to be working on in that time? Also, at the end of each session, make sure that you're pointing out, well, we've got about 10 minutes left. Is there anything you wanted to add before we finish up? So the client knows where they're at. There's no surprises there. When you finish working with a client over a period of sessions, it's good to explore with them what's different now, what they've learnt from counselling, what have they learnt from about themselves, what do they need to look out for in the future. So, for example, if someone has struggled with relationship conflict, what do they need to look out for in the future? What are the early signs that things are going a little bit off track and they need to, look at their strategies again, or maybe get a bit more help with the problem? Same with stress management. What are the first signs, like we spoke about in terms of burnout? What are the first signs that you need to look out for? And what can you do when you notice those signs? Ask the client how they feel about finishing up counselling. And it's okay for you to tell the client that you'll miss them and that you've enjoyed working with them. It's okay to be human and to show that you've enjoyed that interaction. Also pointing out what they can do if they start to feel like they're going downhill again. In terms of maybe they can come back for counselling, maybe they can talk to their family and friends, maybe they can start doing those things that they know help them. So maybe for some people that's exercise, maybe for other people that's catching up with their friends and going out for a walk, or having a coffee with a good friend, that kind of thing. So having a bit of an action plan for if they find that they're sliding a little bit is always a really good thing for a client to feel confident, that they know what they can do if they start to slide. And again, it's useful to say to someone, there's no harm in just checking in and coming back for counselling, or coming back for a session down the track if you feel that you need it in the future. So some clients feel that because they've finished a set of counselling sessions with you, that it's kind of that they've failed if they need to come back. So you might want to point out to them that it's perfectly normal to want to check in every now and then just to keep on track. So that kind of normalizes it, that they may need just to tune up every now and then. Maximize your experience of success. So like we spoke about in terms of burnout, there are two areas of your professional life that you can focus on and that you can control. Professional expertise, so that's developing skills in particular areas. So looking out for professional development opportunities all the time, doing something every year. And when you start out, I'd probably expect, more than every year. You probably want to be doing a couple of workshops at least in your first, every year, in the first couple of years out of uni. Relationship and working alliance. So we can focus on how well we build that relationship with the clients. So remembering those two areas, if we can focus on those instead of the outcomes for the clients, we have a better chance of sustaining ourselves. Focus on your small successes. I know in my tutorial group, I'm always telling students to focus on what they do well, because counselling students can be notoriously bad for focusing on what they did wrong or what their weaknesses are. So make sure, maybe get a journal or something and just write down things that you've done well in the week and focus on small successes. So it's important to realise that it does take time to develop mastery, and try not to get impatient with yourself as you kind of fumble along and make mistakes and have a bad session every now and then, and that kind of thing, because I think I might have said this before, but the best learning for you is usually when you do make mistakes or you don't do something as well as you could. As long as you stay open to learning, you will continue to develop. But it is a process, so be patient and try and enjoy that process. Try not to rush it. Keep feeding your professional self. So doing the masters, it's almost like you've been overeating, you know, overfeeding your professional self with lots of new theories and skills and ideas and things. But when you go out into the workplace and you are working with maybe 4 or 5 clients a day, something like that, you're expending a lot of emotional energy. It's important to have that intellectual input. So make sure you feed that intellectual self with reading, with theories, with training, that kind of thing. So it doesn't become just an emotional, compassionate endeavour. There must be that intellectual side too. Don't ignore your family of origin issues. So, you know, particular sensitivities that we have, or things that we're uncomfortable with, or vulnerabilities, triggers. We need to become aware of those things, because they will play out in your sessions if we're not aware of them and if we haven't kind of processed them a little bit. It's not to say that that we need to resolve every single problem we've ever had in our lives, or sensitivity. That's not really realistic, but we do need to be aware of them and have some way of managing them in session. So that's why we really recommend that you seek out private counselling when you can. So maybe that's when you're out working as a counsellor, or maybe that's before, or maybe you already have. But it is important to do that at some point. Read and explore. So sometimes it's useful to read accounts from other therapists. Yalom is a really good example, because it can help you, it can help normalize, I guess, your own experience and your own self-doubt that you might have, and feeling like you're no good at this, and anxieties and things like that. So reading other therapists' accounts of their practice is useful. I have said that these 2 books, Help for the Helper and The Resilient Practitioner, are good, and I highly recommend them. And reading in general. I've always been a massive bookworm, and I think that indulging in literary fiction, you know, some of them, the books that particularly authors that have a really good understanding of human nature and relationships, it can really help deepen your empathy and ability to understand lots of different situations and dynamics and contexts. And it certainly, like they say, reading does open your mind. So I've always found writers like D.H. Lawrence is really a wonderful observer of human nature. There's so many authors out there, and so I just encourage you to read for pleasure, and read deeply, and read widely. Sustaining yourself. So make sure you have some good relationships around you. Like I've said before, make sure that they're not all relationships where you're the giver in those relationships. Have some fun, you know, have fun relationships as well as deeper, meaningful ones. Find out what nourishes and invigorates you. So find hobbies or activities that you find nourishing or invigorating. Cover the physical, relationship, solitary time, recreation, and emotional needs. So physical, the usual, you know, eating well, getting enough nutrients, exercise, reducing your stress, relationships. So working, having a strong relationship with colleagues, with your family and your friends. Having time on your own is very, very important when you're working in counselling, because we are focused on other people so much that it is really important to have that time for ourselves, to reflect and to process and just to be. Recreation, so doing things that that really take your focus and make you feel restored. And your emotions, so make sure you take care of your emotions. So maybe that means personal therapy for you, journaling. Clinical supervision is an important part of counselling practice. Mindfulness, so just being mindful and aware of how you're feeling is really important. Supervision is an important aspect of counselling practice, particularly for new counsellors. And you will cover supervision more in other courses, but it does help with that self-doubt that you can experience as a new counsellor. It can help you reflect on your blind spots. It can help you debrief when you've had a stressful session, or if you're not quite sure whether you've done the right thing. It's actually a very, very important stress reduction technique, as well as an ethical imperative of making sure that you're practicing well and competently. And it helps you be aware of your boundaries as well. So whether you're perhaps getting too involved with one particular client, or whether you have a blind spot about a particular client. So find a good supervisor, and generally a good supervisor isn't your line manager. So a supervisor is someone that's removed from that management type role. And finally, be as kind to yourselves as you are to your clients. And that's important to reflect on and think, what kind of advice would I give my clients about this? Would I give my clients a hard time about this? So speak to yourself as nicely as you would your clients. Practice self-awareness and enjoy the journey. I've certainly enjoyed the journey with you. Thank you for your attention, everyone. I hope you got something from this counselling in a nutshell talk. All right.